Please take your seats. It's 7 p.m. Okay, let me get this straightened out here. Excellent. All right, thank you, James. I'd like to call to order this county board meeting on Thursday, November 21st at 7 p.m. Roll call, please.
Richards, Rosales, Schrader,
Here.
Schwartz, here. Alex, Bergson, here. Carter, here. Cowart, Esri,
Here.
Harper,
Here.
Harkey, here. James,
Here.
Jay,
Here.
Kibler, Langenheim,
Here.
Maxwell,
Here.
McGuire,
Present.
Michaels, Mitchell,
Here.
Petrie, Petrie, Quisenberry, Alex, Kurtz,
Here. We have a quorum. Thank you. Tonight's prayer is a prayer for those in Gifford tonight. Please take a moment as I read this for those people who have had such a terrible week in our community. Loss can lead to fear, paralyzing fear. This is normal. When the fabric of your life has been torn, fear can be engulfing. It is easy to become overwhelmed and confused. Those feelings are normal and understandable at times like these. But they can't be indulged for long, or you'll become paralyzed. Facts are facts, and denying them solves nothing, improves nothing, embraces the truth of the situation, and allows things to get better, to change and improve. It allows you to claim your power to act. Know that things can get better, obstacles can be overcome, and happiness can return. Even in the face of great loss, letting go of what was helps me to make the best of what is left. I accept what has happened honestly and resolutely and begin my climb back to security and stability, one step at a time. May you be blessed on your journey of recovery from loss. Amen. Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can you please read the notice of the meeting?
Notice is hereby given that a regular meeting of the County Board, Champaign County, Illinois, will convene on November 21st, 2013 at 7 p.m. in the Lyle Shields Meeting Room, Brookings Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purpose of allowing and ordering payments of claims against the county, receiving and acting upon reports of committees and such other matters as may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
I'd like a motion for roll call vote. So moved. Second. Mr. Esri, thank you. Can I roll call? No, it's, I'm sorry, just all in favor? Aye. Opposed? Motion carries. Sorry. A little bit emotional there for a second. I visited Gifford this past week. Again, we'll be there tomorrow. I'll talk about that in communication in a moment. I'd like approval of the agenda and addendum, please. So moved by Stan, second by Max. Any changes to the agenda? Well, we'll get to the consent agenda in a second, Ralph. We'll pull it off. All right. All in favor? Aye. Opposed? Motion carries. The date and time of the next regular meetings and the standing committees are listed. Committee of the Whole and the County Board meetings are listed below. I'd like a motion to approve the consent agenda. So moved. Second. Astrid. Any?
I move that the requested items taken off the consent agenda because it was placed there in error, and make it item 2 under ELUC, item XIIB 1.2.0 or whatever.
Second.
All in favor? Oh, I'm sorry. I forgot to ask Ralph to use your microphone. Thank you, Jim.
Okay. I request that item A1, period, parent, case 732-AT-12, parent, be taken off the consent agenda where it was placed in error, and make it item 2 under ELUC, item XIIB, period, 2, period, parent, period.
Thank you.
Second.
Second, Mr. Schroeder. No, it's just pull it off. All right, on the vote for the rest of the consent agenda, all in favor? No, I'm sorry, roll call. That's where I needed the roll call. I knew I had it backwards tonight. Can I have a roll call vote on the consent agenda, please?
Richards? Schrader?
Yes.
Schwartz? Alex? Bergson?
Yes.
Carter? Cowart? Esri?
Yes.
Harper?
Yes.
Hartkey?
Yes.
James?
Yes.
Jay?
Yes.
Langenheim?
Here.
Maxwell?
Yes.
McGuire?
Yes.
Mitchell?
Yes.
Petrie?
Okay, yes.
Yes.
Petrie? Quisenberry?
Yes.
Kurtz?
Yes. Motion carries. Thank you. All right, public participation. Just ground rules. You'll be called by name. When you come up, please turn on the microphone. You'll have 5 minutes to state your business, and we will have a 1-hour time limit till about 10 after 8. We have quite a few tonight, so the 5-minute rule will be adhered to. First public participant is Kay Busboom.
Hi, I am just here to provide any additional information on ordinance number 939. So if you have any questions on that. Oh, okay, yeah. When you come to it, if you have anything, and. Nope. That's the only reason I'm here. I have nothing else, so, thanks.
Hi, my name is Jessica Watson, and I'm from Champaign. I live in Champaign, and I have been speaking the last few times, about 4 times, about how I have schizoaffective disorder, and therefore I know that it would be better to have the social services and preventive services for people with mental illness and then go to the expensive that was proposed of the county jail. And I think from last meeting of the Champaign County Board, I was really proud of all you because I felt like you were all voting from your hearts and caring about your fellow human beings. People like me who could just very easily in a psychotic episode end up in the Champaign County Jail. And I just think it's better to do the preventative services, and I'm so proud of all of you for voting from your heart to not incarcerate people who might get psychotic and not mean to steal a cup of coffee or something minor. And I just wanted to add that driving over here tonight from where I live near downtown Champaign on Church Street between Prospect and downtown Champaign. And I was going to go right through downtown on University coming out here, but right by the city building, I think it was an old police station a while ago, there was somebody gotten hit in the dark, rainy night. It's so dark and cold and rainy out there, and I could see people had stopped and there was going to be a policeman coming, but nobody had gotten there yet. It was all dark and somebody was lying on the ground, crumpled. And that just affected me because people were going to help, and people like me, we saw it, and so we turned the corner right real quick to not get into the situation and cause, trouble in where it was going to be congested. And what I thought and what I want to tell you is that most of us, when we see somebody in distress, hit by a car, crumpled on a wet night, our hearts go out to them. I really believe that, and you hope the police comes and you call 911 and you want the ambulance to come really quickly. And that's kind of your first thought, because we are all a community, people in need and also people who have to give. And there's lots of money that can go towards things for the heart and for people that need services, like at Community Elements, counseling and medicines and things like I get, Medicaid, that help me be able to speak to you and do my artwork and show my art that I told you about. There's an exhibition on right now at the Champaign Park District's Springer Cultural Center. I have 60 photos on looking there to still go before Thanksgiving. It's been a month exhibition, and lots of people came to reception. 50 people from the community came and enjoyed the cheer and fellowship and art and just saying hello downtown. So I just want to thank you, and I just want to remind you that this is a start. It wasn't everything that people like me asked for, lots and lots of money to go to the social services, but it is a start, and I am so proud of you all for voting from your heart, and please continue to do so. Thank you.
Don Lynn. Don? Thank you.
My name's Don Lynn. I'm applied for the appointment to the nursing home board. I am a prior nursing home administrator. I run the Illinois Veterans Home in Quincy, Illinois, which is a 600-bed facility with 600 employees. I'm also the retired adjutant general from the state of Illinois, which was I was head of the Illinois Army and Air Guard here in Illinois. I presently serve on the Board of Trustees for the city of Mahomet, and I may look forward to working with the nursing home because I love old people, because I am one. So, so thank you very much.
Thank you, Don. Appreciate it. Thanks for coming and introducing yourself. Paul Muniz.
So Paul Muth at 207 West Illinois in Urbana. I've addressed you a couple of times, and it's been about the jail reform movement, or the whatever you want to call it. And I've been going over some of the recordings I've done of Kalmanoff. I've looked through the document, and I noted that I wanted to talk about the pretrial services. It's kind of a bizarre name for just basically having a better way to sort out who should be incarcerated. Apparently it has happened that people who were charged with something that doesn't even involve any jail time get put in jail for an indefinite period of time, and that doesn't seem reasonable at all. But that's just the reduction ad absurdum part of phenomena. There are people that may or may not, you're guilty till you're proven, you're innocent until proven guilty, right? Though sometimes one wonders whether that is inverted. So Kalmanoff feels guilty about not following through. He said he was over in Tuscany or something over the summer and let some aide handle the introduction of this Virginia short form. I mean, he basically, in one of the documents, he basically says, if they don't want to do this pretrial services, just tell them how ubiquitous it is. It's everywhere. People do it. The state of Virginia does it. And it seems to me that the trial that was done, I don't know why it turned out the way it did, because that isn't the results in many jurisdictions around the country. It doesn't make sense to me. And I think it's basically entrenched, and we've never done it that way before, sort of phenomena that's typical. And I don't know, as county board members, what you can do about influencing the judge and the administrator, but I think that's where something has to change, it seems to me, because there's just no reason to have such a closed mind about this. It does work in a lot of jurisdictions around the country. People don't need to be thrown in. They don't need to be softened up to plea bargain, or if that's any of the calculation that's going on. And I don't know how clear that is, so I should probably stop now. But I just urge you to find a way to give that a fair trial. And I think from around the country, the figures are, the results are that it's a very useful thing to do as far as cutting costs on incarceration. There are many other things to do too, but that's one of the things that Cal emphasized on the front end would lower costs and maybe free up some money to do some of the other things that need to be done. I don't think that the refurbishing of the entranceway and the reception area and doing more for the newly placed women's section in the satellite jail are bad projects, but they could come possibly out of discretionary funds, since the sheriff already started doing that. But I don't think it should come out of pretrial services. I think a real trial of that would show that it is a successful, part of the having a more humane and fairer justice system. So thanks very much.
Thank you. Chris Evans?
Thanks a lot for enduring public participation tonight. Chris Evans, District 8. I was a little concerned about the article in Mr. Dye's newspaper about the pretrial services. And I guess the first thing I want to remind the county board is the definition of a stakeholder. It's been thrown around that those that work in law enforcement are the stakeholders, but I think you know already that also the stakeholders are the families of those who are incarcerated, the public you're trying to protect, and especially the public who pays for it. We've done 2 years of work on this jail question, and it's a little disappointing that there's been an end around, a secret study with secret criteria with the timing being that it tries to, with the conclusion that pretrial services doesn't need to be done, and that it is already being done. But what the consultant talked about was 2 dedicated officers, fully salaried officers who, when I say officers, I mean employees that do nothing but pretrial services and do try to do the screening. I think, in terms of we don't know what the criteria was that was used, but it's not a good look that you don't have full transparency. And the study was done by members of law enforcement who have an interest in building more jails. So it's just not a good look. The ratios that were arrived at are very similar to what drug court ratios are. There are over 1,000 drug cases per year, and there are only 20 graduates out of drug court. Is that cost prohibitive? I mean, we went ahead and invested in an additional, I believe, $32,000 toward drug court. So I think that the pretrial services experiment needs to be tried over the full year, and to see if we can drop the counts. If we can keep 500 people out of that jail, that might be the savings that we're looking for. I'm also concerned about some of the county board members' commentary in the newspaper article about already remodeling. I know that we should remodel for the women, but Board Member Hartke dropped that there might be a consideration for a $2 million mental health pod. So if there are any building plans, I hope that we would get that to the light of day, and that the public would have a chance to weigh in on any of those kind of plans. I would say that since we built the jail, the satellite jail in 1995, we've doubled the number of criminal cases in this county. And in 2010, 10% of our population was living at or below the poverty line. Now that we've doubled the cases over the last 10 years, we have seen our poverty rate go from 10% to 24.5%. So I think it's in our best interest to not create more tax liabilities, to keep people working, to keep people healthy, to improve the public safety, to reduce addiction, prioritize our jail for acts of violence, and create a healthier community. So again, I want to encourage us to keep moving toward innovative ways instead of the old lock them up and throw away the key method. My off and on study of this for 20 years is, and it's counterintuitive, but more jailing means more poverty and more crime. And I think if we can keep people out of there and keep people working, it'll be better for everybody. Thanks a lot for your time, and thanks for listening.
Durrell Cruz, please.
Good evening, and thank you for the opportunity to speak to you this evening. And I guess I want to kind of convey some bafflement on the part of my mind as I followed the issue with regards to the criminal justice system recommendations and the recent article in the News Gazette regarding pretrial services. And one of the things that I sensed from reading the article that troubles me greatly is the fact that it seemed like this pilot study was happening, and that maybe the Justice Committee and the public and maybe even the county board wasn't fully aware that that was even occurring. And so before I speak to that particular issue, I think one of the things that comes to my mind as a major concern is that even though I have great respect for our criminal justice officials for the jobs they do, they are elected officials, and they're supposed to act on behalf of the community and hopefully work in coordination with the county board and the Justice Committee of the county board. And this particular pilot project doesn't seem to have occurred within the context of good communication in terms of collaborating and understanding the dynamic that's going on. So my major concern is that any of the recommendations that may come before you, if we don't correct the lines of communications in terms of what we're attempting to do, what our expectations are, and in terms of what we hope to find out, we're going to have a major problem with accomplishing anything successfully that we've come up with. And let me give you a concrete example in terms of these pre-trial services. A 5-week trial, okay? I don't understand exactly what occurred. There definitely needs to be some transparency, but I did go back and read the appendix and what was recommended very quickly. Pre-trial services, phase 1. Let me just quickly go through and highlight. The criminal histories will be reviewed. They will obtain a list of arrested individuals. The risk assessment specialist will conduct a brief interview. They will contact references of those being arrested. They will communicate with collateral contacts where appropriate. They will complete an objective risk assessment. And then the key and most vital part of it, they will prepare a bond report that will go to the arraignment hearing for the judge to consider in terms of how to determine what type of disposition should we make in this case. Now, I would simply ask, did this trial do all of that? Were there bond hearing reports? Were those interviews conducted? Were those things done? And then that's just a list of the activities to an appropriate, effective pretrial services program. And in the report, it also talks about an implementation phase for one. It says it's supposed to be designed September 15th, formalize the program, policies and procedures by October 15th of this year, and establish in detail the structure and rules for daily operation. It talks about selecting the staff on November 1st of this year, have staff training so the people who are supposed to be doing this know what they're doing and what they're supposed to be collecting by November 15th. Complete the testing of all of these initiatives to make sure they're in place the way you want them to work by November 30th. And then launch the pilot program December 1st of 2013. The pilot program then goes till August 1st, 2014. You got 8 months in which you get reports back to look, is this working or not? How could you explain a 5-week pilot project of pretrial services unless you ask the people who did it, did they meet what was asking or recommended in terms of making the program work? That's what's troubling to me. What's troubling is these recommendations are being made on how to prove the criminal justice system. But until the county board, until the criminal justice subcommittee, until the stakeholders get together and talk face to face on how you want this to occur, you have the public sitting here thinking, what the heck is the county board doing? What is the criminal justice committee doing? What are our key stakeholders in the criminal justice system doing on their own? And
Mr. Cruz?
yeah,
That's your 5 minutes.
yeah. So I
Thank
would
you, sir.
suggest we establish some stronger communications and all get on the same page
Thank you,
before
sir.
we defeat each other.
James Kilgore.
James Kilgore, 511 South Draper, Champaign. I think probably the most important thing that I've experienced in the 2 years that we've been talking about this criminal justice issue is the way in which the process has taken place. The way in which we've, along with the county board, public participation and the process has been out in the open. We've had the county board, I think, has set a precedent for itself in terms of having public discussions, public forums, hiring a needs consultant, presenting the findings in public, appointing a community justice task force with public meetings and presenting their report in public. And I think that's a great achievement. And I think if there's something that should endure from this process, it's that. So I'm quite disturbed at the fact that we seem to have gone a little bit backwards in terms of the response from the judiciary and company around the pretrial issue. Not so much that they conducted the pilot, which is a problem, but the fact that when the county board resisted their findings on the pilot, that they resorted to having private meetings with individual county board members in an obvious attempt to avoid the Open Meetings Act. And I can tell you, as a member of the Community Justice Task Force, I, for over a year, steadfastly avoided even sitting with two of my good friends and having a cup of coffee because of the Open Meetings Act. So I think we need to respect this process, and therefore I really encourage the county board to conduct, if we have problems with implementing the pretrial services, then the county board should, should call for a public process, call for a study session. If the judiciary is convinced that the conditions in Champaign County are so unique and so different, and the system that's in place is so much better than everywhere else, why should they be ashamed to come and explain to the public how wonderful the existing services are, and therefore we don't need to change? What is the hesitancy? These are elected officials. You are elected officials. You have political power. You have budgetary power. And so I think you have the power to make these processes public. So I hope that you will use that. I hope that out of this we will have a better pretrial services program, whether it follows what Kalmanoff says or whether after a process of public scrutiny, we all collectively decide that there's no possibility of improving what's being done, and we're all totally convinced of that. But until we go through that public process, I don't think we're there, and let's please not go backward and start avoiding the Open Meetings Act and get back to where we started in early 2012 with small meetings taking place unannounced behind closed doors. Thank you.
I'm getting used to this name. I think I'm pronouncing it correctly, Nilufar Gambayati.
Yeah, that's why I come here so often.
It's nice to see you again, Nilufar.
Very nice seeing all of you. I'm just so used to coming here that I think I would, even after this, I would just keep coming back. Basically, what I like to say, first of all, is that I'm so happy that we are continuing these discussions rather than just going by certain recommendations that basically are not real recommendations and should be taken by all of us as an insult to our intellect and our and those who somehow have been impressed by the report, are in awe of this report, I strongly suggest them to go back and read the report. There is nothing in it that suggests that there is any respect there for either the county board members, intelligence and integrity, or the community members. So that's enough for that. The fact that there are some officials who are against pretrial programs does not by and in itself mean that the money should suddenly go from pretrial to like maintenance, building, or even re-entry programs. If the gatekeepers have serious problems with these programs, as Mr. Kilgore mentioned, the money you all have to say yes, vote yes to the money, and then ask the gatekeepers to come forward with well thought out alternatives presented to the boards, presented to the community member, and let us together make a decision regarding what works best for our community as a whole. So the fact, my point is that I strongly urge everyone to say yes, to vote yes. That doesn't mean that the specific program has to go the way that Mr. Kalmanoff or someone else has suggested. It just sets money aside so that we would have the ability to come up with the best practices that we can find all over the United States, giving great results. So basically this is what I wanted to say, and also wanted to mention that our state attorney, for example, she is all for money be kept for programs that would help our nonviolent offenders to keep them out of jail. She probably does not like those programs the way they look right now, although they are very vague. But she had stated herself, at least to me, and I'm sure to a number of other people, that she really favors the money to stay where it is in the budget currently. So thank you very much for this opportunity, and I hope we all leave here happy and satisfied.
Thank you. I hope to see you again, Nilofer. Bobby Trist?
So you go from the hardest name to pronounce to the easiest. So I'm Bobby Trist. I live at 503 North Fair in Champaign, and I've been working on this project from the beginning since January of 12. As I said, in January of 12, I have a son who was involved with the criminal justice system here. And so that's affected me personally, especially with the telephone fees, which we got rid of some time ago. I want to thank the county board for holding firm and not taking the money out of the budget, even though there was the article in the newspaper and the stakeholders said, well, this isn't working. And I was very distressed at them saying only 1 out of 238 was able to be diverted. So my question is, as a professional, I'm a licensed clinical social worker, as I've told you before, with current license. What are the criteria so that they only found 1 person who could be kept out of jail? And I know that the people on the county board, all of you are people of good faith and mean well for the people of this county. And I'm grateful that you have listened to us week after week and month after month. And I'm very grateful that last month, I guess, whenever it was it last week? I guess it was last week. Time flies. Well, I was out of the country in October, so it must have been last week at the Committee of the Whole, that you voted to keep the money for, what's the name of it? Prevention? I can't think of the right, pretrial services in the budget. And I thank you for that, and I encourage you to keep the money there and to let the process take its course as is suggested for a real trial and with dedicated staff for the 8 months that are suggested so that we can really see what happens. I'm totally convinced that we do not need to have as many people in jail as we do now, especially those who are there pre-trial. When my son was in the jail, he was kind of a hapless individual and got himself into a lot of trouble, but he wasn't a flight risk. He really would have been all right on his own recognizance. For one, I would have drug him there by the nape of his neck. And I think there are other people like that that don't actually need to be in jail pre-trial. We don't need to be paying that kind of money, taking people away from what little jobs they might have or from their family or, you know, taking care of their children, perhaps losing their apartments. So thank you for not taking it out of the budget, and please continue. Thank you.
Thank you. Danielle Chenoweth?
Danielle Chenoweth, 412 West Illinois Street in Urbana. First off, I just want to thank you again for taking the first step to decrease crime, decrease poverty, and decrease the jail population. Last time I spoke before you was maybe 4 to 6 weeks ago, and I was applauding the public process that we had gone through, the transparency and accountability we had done. And so opening the paper, I was shocked to see us moving backwards after I think we worked so hard and so well to establish a public conversation about the jail population. Frankly, yeah, I think people before me have been more polite, but it's very much looks like monkey business to the public to do this kind of pseudo 5-week pre-trial. We're an academic community, so pretty much every academic will laugh at that and understand that a 5-week trial isn't really a trial. I think what is actually at stake here, and I do want to speak to something Bobby said. She said that one person was diverted, but if you actually read Judge DeFanis's memo, the state's attorney and the judge worked to divert quite a few people. And so you could say, okay, well, why would we need to hire a couple of personnel to sort people in pretrial services if the judge and the state's attorney are going to get together and let folks out? If I were in your position, that would be the reasonable question I would ask. Here's my answer to that question. I think what is at stake is whether or not to have a kind of more scientific, fair, process-driven approach to pretrial services, or something that is more subjective, that looks at discretion, where it's actually unclear who's let out and who isn't let out. This actually gets to the Racial Justice Task Force component of what was requested in the consultant's report that is an unfinished piece of business, which is it should not just be left up to the discretion of this judge or to the state's attorney to make that decision, okay, and to use their discretion. I don't think that you can call a study when the folks doing the study also have their hand on the spigot, and they can basically turn it on and off and say, okay, for 5 weeks, let's make it look like no one needs this. We can just get together and decide to let these folks go. Okay, let's now turn the spigot back on when no one's paying attention. I mean, come on, this is very obvious from both Judge DeFanis's memo as well as the reports in the News Gazette about what's going on. So let's just kind of peel the blinders off. So I'm here to ask you not to meet behind closed doors. That is my request for you. Do not meet behind closed doors. It is a break in the public trust. It is the way that public officials get around the Open Meetings Act. It's not fair. It's not, it really honestly shouldn't be legal that, Georgetown can meet with the coal company and they can strike this deal to basically give away all their water. That is the kind of thing that we're seeing here if you go in that direction. Last comment, and I know I'm close to my 5 minutes. It's cold outside. One of the things that happens when it's cold outside and the fact that we don't have enough shelters in town to house families, single women or single men, is you will see that the jail is actually full of folks who are homeless who broke a small infraction to have a meal and a place to sleep. So when you look at decreasing the jail population, you should also look at what can we do to work with the other municipalities to address the homeless situation. Last, I want you, as you fund programs, to be careful to monitor the effectiveness of these programs. I do not think all programs are the same, and I think that this community has a long history of getting people to shut up by throwing money at youth programs and not necessarily looking at the youth programs and who's running them and who gets paid and how much they get paid and are they actually showing up? Are things working? We, the public, are going to be watching where the money goes. We want accountability with our tax dollars. We want to make sure that programs go to decrease the jail population. We want to see consequences. And we'll be monitoring the programs, not just the government programs, but also nonprofits.
Your 5 minutes.
Okay,
All right.
thank you.
Thank you. Ron Coaster.
Hi, my name is Ron Kester. I live at 1209 West Oregon Street in Urbana. I also want to talk about the pretrial services program and my response to that, the events that have taken place over the last few weeks. I was really shocked to learn that people who were charged with implementing this program would really try to preempt the legislative process by trying to re-engineer the budget and say the money should go elsewhere. So on a gut level, I was really angry about that. I couldn't imagine, just for comparison purposes, the university saying to a department, we want you to do this, and then a couple of weeks later, the department feeding a story to the local newspaper saying, no, we're going to do something else. I mean, that wouldn't happen. That sort of thing would call for a reprimand, and people might get fired over something like that. And I thought that's what the county board would do. County board would call people forward and say, how dare you try to preempt what the public wanted and what we deliberated about for more than a year? How dare you do something like that? So on a gut level, I was outraged. But I've heard a lot of talk tonight about the gatekeepers and what they see versus what we might see. So I wanted to provide a different perspective for just a few minutes. I just came back from the county jail not an hour ago. I'm a volunteer teacher there. I teach students GED and help them to prepare for that test. The GED is what people get when they drop out of high school. So a lot of the students are trying to get their GED, and then when they're released, they hope to go on to a place like Parkland and get a degree there so they can get a better job. And what I've seen this semester, I've seen about 8 students. 7 of those students were there for nonviolent offenses. Now, I don't ever ask that question of students, but I do ask the question like, what's your schedule like? How long are you going to be attending classes? And at that point, a lot of times they will start talking about their situation to me just for a few seconds, for a minute. 7 of the students were there for nonviolent offenses, and most of them were employed. They were employed and there for nonviolent offenses. The one student who was there for a violent offense had his case dropped and he was released. So that was my survey this semester of somebody who actually is in contact with the residents of that jail. And so what I want to know is, why is it that what I'm seeing is so different than what's being reported to you, that we can't release anybody? These are people that I got to know over the course of months, and I could have released any one of them. They were as good as the students as I volunteer and teach at Parkland, at the Adult Education Center there. In fact, a lot of them were stronger. They had harder experiences. They had a better sense of what they wanted to do. They were the kind of people who I would have reached out to and employed. They would have done work like landscaping for me. That's the kind of jobs they had. All right, so we have nonviolent offenses, people who are employed, people who had families. And what I want to know is, what is the criteria that's being used to say those people ought to stay in the jail? We ought to keep feeding tax dollars into keeping them there instead of sending them back to their jobs, back to their homes, back to their families, and awaiting a trial date. Why is it that they're serving time there in the jail? I think that we really have to ask that question. The other thing that was told to me by the students there was, there were plenty of people who were homeless who were in the jail. They were being kept there, right? That was what was producing the crowded situation. It would get cold, the conditions would be miserable. They would do something minor, create a public disturbance, so they could get in the jail, get food to eat, and get a warm place to stay. Now, I would never do that. But someone who's in a position to choose between living destitute and possibly really injuring themselves by living outside versus making a commotion and being guaranteed that you're going to be in jail for a couple of weeks, I think that'd be a harder choice to make. So when Danielle Chenoweth a bit ago said that tried to tie these problems together, I think that you can't help but look at these problems as the same sort of thing. You can't help but look at this and say, if the people need a place to stay, isn't that going to make more sense to find them that place to stay than to use tax dollars for the county jail, so that we have problems like this saying that pretrial services don't work? And eventually, you know that the next step will be, we need a bigger jail. That'll be the next step, right? So I just wanted to provide that perspective, and I appreciate you listening tonight. Thank you.
Is there anyone else who wishes to speak in public participation? Seeing none, I'm moving to close public participation right now. And we'll move on to communications. Any communications from the board? I have a couple. I have some good news. I received a letter today from the Fountainhead Drainage District, Mr. James Cottrell, and the district, and this is, I quote his letter, "The district has its annual meeting this morning. All commissioners were present, as well as myself, Don Wather, the district engineer, and Eleanor Blackman, who was who's in the engineering department of the City of Champaign. With regard to the detachment matter, Ms. Blackman reported that the City Council has authorized the Public Works Director to execute the detachment agreement on behalf of the city. 3 originals. It has already been signed by the commissioners. I will receive 2 copies back, one for the district and one to be filed with the joint petition to the court. I anticipate filing the petition in the next few weeks, and the whole process should be done in the next month. I and the commissioners wanted to let you know how much we appreciated your efforts in helping to complete this task. It could not have been done otherwise. I will keep you advised of our progress." Those people in the Fountainhead District will now look forward to, hopefully, the city correcting the flooding problems in that area. The second is, I'd like to give you an update on the Gifford situation. Just quickly. On Sunday morning, emergency management, already on the job, was tracking storms coming across Illinois. By 1 o'clock, the reports were coming in of tornadoes on the ground in a number of different jurisdictions, including Gifford. After we received the report that Gifford was pretty much hit by the 3 tornadoes, the emergency management were put into action and immediately sent out to Gifford. First, I want to congratulate all of the first responders, police, fire, power, and IEMA, the state, responded immediately, as well as FEMA and the local emergency management responded. That afternoon, the sheriff called me, and I had to go to the emergency management office, where I signed a disaster declaration for the county of Champaign. By the next morning, the governor of the state of Illinois also signed a disaster declaration for Gifford, and I proceeded to Gifford to observe the work of the first responders. They had put into process just extraordinary measures that had been trained for in the last few months. They were working quickly in coordination with each other, and were, in fact, had a search and rescue operation up within a few minutes after the Gifford tornadoes. We thank the Lord that there were no fatalities, only 6 injuries, none life-threatening. It was a miracle, considering what looked like a war zone when I went through it on Monday. At this point, some of the power and lights have been restored. The power company had at least 60 to 80 trucks there with hundreds of workers, and they were immediately re-putting up a number of the power lines. Today, the Champaign-Urbana Public Health District is also moving to keep sanitation, rodents, and other animals from moving into the area with food that have been sitting in the refrigeration or in the area now being dumped. We have a major dumpster that's going out there, and we'll be using that to clear all of the rotting food that is now in that area. I will be visiting once again tomorrow morning. I've been asked to meet the Lieutenant Governor. By the way, the Governor of Illinois on Monday afternoon did visit with his entourage to review the situation and give us his support of state and hopefully federal response for funding for the situation. Tomorrow morning, Lieutenant Governor and federal authorities will be coming through Gifford to review the situation, and we've already started. John Dwyer, our manager, and Don Walsh, our sheriff, are putting together the important information and data that will help us to reach the criteria that will bring federal funding back to the Gifford area and Champaign County. Of course, there are 15 other counties now under disaster declarations in the state of Illinois. So I'm sure we will all reach the criteria. Some have said the number could be close to $1 billion in damage. The, I'm sorry. It's just something that you don't realize till, you see it on TV, and okay, it's on TV. But when you're standing in front of someone's home who's turned to Kindle and you don't even recognize it, and you see their life savings and their livelihood and everything that they put into these homes, because that's our biggest investment, and it's all gone. It's very emotional for them and for anyone else who sees that. So I do want to say that hopefully we will recover. I worked immediately with the Regional Planning Commission, who is supplying their expertise to help in rebuilding. I have contacted and worked with our county assessor to help in deferring taxes on these new homes that are built and on property taxes that will be abated until they can rebuild. Working with John Hall, we're working to cut the red tape on getting building permits so that they won't need them immediately and that they can rebuild as soon as possible. I will report back to the county board after tomorrow's meeting, but I'm hopeful that Gifford will recover. They are very strong people out there. It's a small community of about 950 people. In fact, Senator Frericks grew up in Gifford and was with us on Monday. I'm sure he'll be there tomorrow. We all hope and pray that everything in the future will be better, and it's just something that we have to all work together as a community, and certainly it's something that we hope will never happen again. Let's move on. Yes, Chris.
I'm sorry, I guess I did have a couple of comments, communication-wise. The first is with regard to the reentry program request for proposals, which was deferred from the committee of the whole meeting. I'd like to encourage board members that if you do have comments or concerns about that you please share those with the county administrator, the justice chair, because we deferred that because board members felt like they hadn't had a chance to look at it. I would be disappointed if we didn't get any feedback from that. So please share that with the appropriate people. And second, I just wanted to add something to Mr. Kurtz, what Mr. Kurtz said with regard to the situation in Gifford. As a member of the Highway Committee, when we think about first responders, we think about sheriff and police and medical personnel and firefighters and so forth. But in this particular case, I wanted to give a lot of credit to the Champaign County Highway Department, who were among the first people on the scene with trucks and heavy equipment, and they were clearing the trees and clearing the streets to allow the public safety responders and the residents, their insurance adjusters, and the utility crews who were restoring utility service and everybody to get in there. So we definitely appreciate the efforts of the Highway Department doing a tough job up there.
Thank you, Chris. It just shows when something of this nature, the whole community comes together. It doesn't matter what party you're in or what ideology you have. Everyone cares about each other when it comes to something like this. First, Ms. Petrie, and then Mr. Jay.
If I might ask a question. Sorry, Mr. Alex, do you have a timeline for the submittal of comments so Ms. Busey can look at them and integrate them into the proposal to come back in December?
Not my job. I just wanted to make sure that people get those comments in. I mean, the sooner the better. I don't know, Ms. Busey, do you have any particular thing to add to that?
Well, the agenda will have to be prepared by December 3rd. So if you want changes in the RFP and the document that goes out with the agenda for the cow, we would need to have them by then.
Mr. Jay?
I'd like to add to the list that of help that went up there. There was a tremendous response from all of the road districts in Champaign County. And that's where a lot of the heavy equipment and manpower showed up, along with our highway department, which I was extremely proud of, and our emergency services program. And let us not forget MedCat.
Yeah, absolutely. There were so many. I mean, the list is very, very long of how many, as I call first responders, to this crisis. And I thank you for bringing up those. I just couldn't remember all of them. There are just so many people out there working together. Mr. Carter, did you have something you wanted to add?
Yeah.
I just want to say, I called Jeff yesterday and let him know that my concerns were with him, my prayers, and this really was something to see. I seen all of you all out there yesterday, but my back and condition didn't allow me to be out there. But I told him let the people of Gifford know that my prayers were with them, and I hope they recover pretty soon.
Thank you. I also want to thank Stan James and Diane Michaels, who represent District 2 and Gifford. They also came out on Monday to lend their support in anything that we can do to help the residents out there. Thank you, Stan. Any other communication this evening? Over here? Yes. Gary.
I have a couple of comments. I too grew up in Gifford, in that area. I have a strong admiration for that community and for the strength of the people within it. And I also wanted to make a comment about our sheriff. He's done an amazing job up there. He's used a lot of good sense, and I think he's expedited the process quite a bit. So I wanted to give him credit as well. Thank you.
Thank you. Any other comments? All right, let's move on. Thank you. For our approval, I need a motion for approval of the minutes, October 24, 2013, please. So moved by Josh, second by Chris. Any comments or changes on the minutes? All in favor? Aye. Opposed? Motion carries. Mr. Guimo, we have the nursing home quarterly report up next. Could you please join us? Thank you.
Good evening, everyone. I have with me on my right is Kathy Manuel, the chair of the Nursing Home Board of Directors, and we're here to present our fourth quarter update on the nursing home. So what I'm going to cover today, or tonight, is census, financial position, cash position, and I'm adding two other items to the topics tonight. The first is an update on food service and to give you a summary of the annual survey that just was completed last week Friday. So census, if you can see on the chart, over the last 4 months, we have been seeing a slow but steady increase in the census. So through the month of October, the average census was 195. And I can tell you, as of yesterday, our census was up to 197. For Medicare, you could see in June and July, we had a nice uptick, but over the last 3 months, we have moderated at roughly between 14.3 and 14.5 Medicare residents on average. Admissions, and these are admissions per month. That goes back to December of 2011 to October of 2013. And again, you can see in the months of June and July, we had a very sharp increase in the number of admissions, and we have moderated down into low to the mid-20s for the last 3 months. But I also wanted to point out that, again, the average number of admissions in 2012 was 22.2. Year-to-date through October, we're averaging 25.6 admissions per month, which is about a 15% increase between those 2 years. So we are definitely seeing a higher number of admissions on a monthly basis this year compared to last. Again, discharges. At the same time as our admissions are up, our discharges are up at a higher rate this year compared to last. And again, in the months of June and July, while we had a high number of admissions, we also had a high number of discharges. And so again, I think I've mentioned this in the last quarter's report. The good thing is we're sending people home. The bad thing is it would be nice if we could turn some of those short-term Medicare admissions into either a long-term private pay or Medicaid stay, but we're doing a good job of sending a lot of our residents home, which is a good thing from a quality of care standpoint. Now, in the last 3 months, from August through October, the number of discharges has dropped. And again, that is because we've been able to, as people have come off of Medicare, we've been able to, I shouldn't say we've been able, many of those residents have actually converted to long-term residents over the last 3 months. And again, discharges. The average in 2012 was 15.7. Through October of 2013, we're averaging about 20 discharges per month, and that is a 22% increase in the average monthly discharges, again compared to the 15% increase in admissions during the same period. So just to quickly recap with the current census, admissions do remain strong, and it's occurring at a higher rate in 2013. We do have a higher number of Medicare discharges to home at the same time, which is causing our census to moderate this year. However, over the last 3 months, as we've been able to retain more long-term residents, our census is showing gradual positive improvement. And the other thing that I forgot to put into those charts is that over the last few months, the number of private pay admissions from the community has increased. And we are getting a lot of those referrals from the assisted living facilities in the community.
Scott, can I ask you something quickly? So on the Medicare, obviously the number of days matters, but also the per diem. Do you have a sense of the dollar per day that we're getting on average? Is that pretty flat? So it's really the number of days only?
The average Medicare per diem roughly fluctuates from between $435 to about $460 per month. And it basically fluctuates based on the acuity or the, we call it the case mix, or basically the number of services that we're providing to those residents.
Yeah, quick question about census. It's my recollection that December and January, we typically take a dive on census, and last year we were at record census going into December, and we dropped a long way, and we're not all the way back there. So do you anticipate the similar kind of holiday, get home for Christmas drop off that we've seen in previous years, and is there any reason to believe it won't be as much as it has been in the past?
Based on the historical annual trends, I'd say the likelihood is that we'll see that again. And again, only time will tell. All right, financial position. So this chart updates the cash flow from operations, which is the net of revenues and expenses without the depreciation expense included. And so again, without going into detail on each month, basically for this year, and especially, let me point out for the last 3 months, we've been just about break even on cash flow. Now, year to date for 2013, we have squeaked out a positive net cash gain of $34,000 year to date. And we're definitely way behind 2012. I think at this point in the year, in 2012, we were roughly to the positive of about $300,000 in cash, and maybe a little bit more. And so this chart, this next chart basically overlays the census, and that's the yellow line compared to the cash flow. And again, you can see there's a pretty close or strong relationship between census and the ability to show positive cash flow on a monthly basis. So again, earlier this year, we really had a drop off in census, and it's taken us a little longer to get the census moving back up. But you can see as we have increased our census over the last few months, we've been able to reverse the negative cash flow from operations into a more positive or break-even cash flow. And again, if you look at 2012, back when we hit an all-time high of census of over 210, we saw a significant positive improvement in our monthly cash contribution from operations. So obviously the goal, I think, as we have always stated, is census and Medicare census is going to drive the financial bottom line of the nursing home. And again, I am optimistic because we see the admission numbers stronger this year compared to last year, but the discharges are also up at the same time, which is preventing us from getting a higher census back to 200 or above. And again, this is just the updated slide on the amount of monthly contract nursing expenses, and you can see for the last 3 months, and I think I've pointed this out, the goal is always to try to get down to zero contract nursing. We were down to less than 20,000, but in September, we showed a slight increase to just under 30,000. But again, we continue to strive to try to get our agency staffing down to the bare minimum as much as possible.
Scott, is there like an effective bottom on this trend where we won't be able to get below because of turnover or illness or what have you?
There are a number of factors that will always make it very difficult for us to get to eliminate agency staffing. A lot of it has to do with the amount of benefit time that the staff is allowed to take off, holidays, TOPS time. We have a personal business day that allows employees to take with a 24-hour notice, and that, again, is in the collective bargaining agreement. And so if we have to wait, if we have 24-hour notification, a lot of times that hampers our ability to fill that position, as opposed to if we had, you know, a week or more to schedule someone to fill into that position. We're always going to have turnover. I think it's the nature of the beast for our industry, but we're striving to identify better hires, trying to retain our employees as much as possible. And again, our turnover has decreased over the last couple of years than what it was 3, 4, 5+ years ago. And that's one of the metrics that we've been working on with the board of directors to show what our turnover rate is, and probably one of the things that I will incorporate in the quarterly report to all of you. All right, cash. Again, this chart shows 3 items: cash, accounts receivables, and accounts payables on a monthly basis. And so again, the bottom line is the cash, and you can see for the last 3 months, we're showing a decrease in cash. Through September, we were at about $478,000 or $479,000 in cash. So obviously, that looks to be of concern, that our cash is dropping. But I can tell you that it is expected that through the course of the year, we're going to start off high and gradually decrease towards the end of the fiscal year. And again, we talked about the tax anticipation warrant. It will provide us an influx of roughly $900,000 or $935,000 this year, and we start back up again at the beginning of the fiscal year. And again, I wanted to point it out, in previous years prior to 2012, those funds were needed not to, say, refund our cash balance, but we were literally spending that tax anticipation warrant money before it's received. And again, we were spending it by having our accounts payable outstanding by a significant amount of days or months. So again, a couple items or things that have happened over the last few months that have caused our cash to drop. Medicaid payments in August were delayed by 25 days. What that means is we did not receive a Medicaid payment in the month of August. We did receive it in the second week of September. Now, in October, we did receive a Medicaid payment, and again, information from the state is that they don't anticipate any further delays in Medicaid payments. But again, I think I told you the last time that the state had said that they did not anticipate further delays in Medicaid payments. So, and we had that 25-day delay without notice from the state. So again, I always take a wait-and-see attitude to see what happens with our Medicaid payments. The other item.
Just real quick, from looking at this, if we collected everything that was owed us and we paid everything we owed, we'd be roughly $2 million in cash?
Yes.
Thank you.
I think that's a good approximation. The other thing that we've done over the last couple months is that we've gotten our accounts payable back under 60 days. And we purposely wanted to hit the target so that we could eliminate any late payment interest penalties from our vendors. And so roughly that required the use of roughly $150,000 to $175,000 in cash. So that was another big contributor to the cash balance going down. And again, it was done with a lot of thought in projecting our cash requirements for the rest of the year. And we felt that we could easily get those payables caught up by spending that extra cash. I think it was well worth doing to try to get rid of all those interest payments. I also just want to point out, while this is through September, that in November and December are 2 months where we always have higher cash needs. November because we have 3 payrolls, and in December we have a principal payment that we do of roughly $239,000 or $240,000. We also have a liability and property tax payment to the county of about $105,000. So just to put in perspective, in November and December, our cash requirements will be about $1.5 million and $1.6 million respectively. For all the rest of the months, except for the 2 months where we have 3 payrolls, we typically will spend or pay out roughly $1 to $1.2 million in cash. I can tell you that at the beginning of this week, our cash balance is about $700,000. We also anticipate in December our quarterly IGT, or intergovernmental transfer payment, which happens again on a quarterly basis. And again, the state never tells us ahead of time what that payment exactly is going to be, but we anticipate that should be about a $150,000 to $200,000 cash infusion that will also help get our cash balance up for the beginning of the fiscal year.
Mr. Quisenberry's question brought up another question, at least on my part. Accounts receivable. I'm sorry. Yes, accounts receivable. How much of that do we attribute to uncollectible debts, and what kind of progress have we made on that subject in recent times? Thank you.
I don't know the exact figure of uncollectible receivables is in that number of roughly $3 million. We have been actively working on trying to reduce our bad debt. With Medicare, that means that we need to make sure that we are billing Medicare properly. You have basically a 1-year window to get your Medicare bills in, and you have to retouch your bills within 12 months, which means that if you get a claim rejected, you have to try to resubmit it within 12 months, and if you don't do that, it falls off and you won't get paid for it. And that basically takes diligence on the part of our billers to make sure that roughly every month, 80% of the Medicare claims are paid, or they go through clean. And so what's required is every month they have to go back and take a look at the 20% that was kicked out for whatever reason, determine the reason why that claim wasn't received properly, or what's wrong with that claim, resubmit it, and every month that 20% should systematically be reduced, theoretically, until it's 0 before the 12 months is up. On private pay, we are instituting methods to make sure that if someone doesn't pay within 30 days of the original bill, that we'll follow up with a letter on 60 days and 90 days. And again, we're going to be talking with the state's attorney's office on collection activities and whether they want to participate or whether we'll go outside to provide collection services. The other thing is we are also working with the state's attorney's office on larger outstanding debts, of which we have 2 or 3 cases that we are working on with the state's attorney's office to try to recoup those. And we've been successful over the last few months in recouping some of those balances, which are typically greater than $10,000. The third issue with accounts receivable is Medicaid. And again, besides the payment delays, the other issue with Medicaid is what we call Medicaid pending. And those are individuals that are waiting to receive Medicaid eligibility for their Medicaid applications. So we will not take a Medicaid pending from the community, meaning that an individual that has never been in a nursing home and covered by Medicaid, the risk is too high for non-payment. But we do take Medicaid pendings if they came from the hospital as Medicare, or if we had a private pay resident in the facility who spends down their assets and now has to convert to Medicaid. The problem that all nursing homes in Illinois, including all the county homes, is that the Medicaid application process, or the time it takes for the state to process an application, has increased from an average of 3 to 6 months to 6 to 12 plus months to get an application reviewed and the stamp of approval by the states. What that means is that we are basically not being paid for that person while that application is pending. And it's one thing to wait 3 to 6 months, and in our case, it's not too bad. We're talking 6 to 9 months. But right now, we have 15 Medicaid pendings in the nursing home. On an annual basis, that equates to over $500,000 on an annual basis in non-payment for those individuals. So this is a huge issue, and especially for the county homes, because we take a higher percentage of Medicaid, and we will take these Medicaid pendings, but we have made the policy that we cannot take a Medicaid pending from the community. It's just too high of a risk for us, knowing that if that person comes into the building, we will not be paid for potentially 6 to 9 plus months. And there's also the potential that that individual may not qualify for Medicaid, and at that point, we are really stuck.
Thank you very much for that explanation, and I thank Mr. Maxwell for bringing this up. I would hope that the next time we have a report from you in 3 months, that we might have a matrix that lays out some of these factors of where we stand on the collection and what percentage has been collected and some of that. So we have an idea of what the potential is for income, and that would help us have a better wrap around how the finances of the nursing home are. Thank you.
I'm going to skip this chart because I think I covered all of this. So let's switch from our normal topics and let's talk about food service. So the food service, dining services, we've had problems in retaining management staff. So we have a director position and an assistant food services director's position. So back in early of 2013, we identified that we had significant issues with the food service department, and the director at the time was put on a performance improvement plan, and that director soon thereafter resigned. We were able to find and retain a new director who happened to be moving from the Chicago area. We were not able to find anyone from the Champaign County area, and we were lucky that we had found someone who just happened to need a reason to move down to the area. Unfortunately, she did not work out. At the same time, we had been working and had found someone to fill the assistant director's position, and it turns out that he started his position a week after the director left. So at that time, we also were seriously evaluating the option of outsourcing the management of the food service department. But that assistant director came with a very strong skill set of working at the U of I. And within a few short weeks, we were able to see significant improvement in the dining service program. So we took a wait-and-see attitude to see if this was going to work out and see if we could hire or actually find and hire a director. So the director's position typically, besides having food service experience, also has nursing home clinical experience, because that director is also responsible for completing the dietary portion of the minimum data set or MDS assessments that are required for every resident that's in the building. That individual will also implement a plan if we identify a resident who shows weight loss or weight gain, and also participates in the care plan meetings. Our assistant food service director, coming from the university, did not have any nursing home experience, so we continue to look for a director with clinical experience. At the time that he left, we still had not found a director. This occurred last week, and as a result, MPA and administration basically relooked at the option of outsourcing the management of food services. So back again in August, we evaluated multiple companies to see if there were any interest in providing management services or personnel to Champaign County Nursing Home. So we contacted a number of companies, including some of the bigger companies like Sodexo. And unfortunately, I shouldn't say unfortunately, for whatever reason, Sodexo and some of the other bigger companies were not interested in submitting a proposal to us. But we did identify 2 companies that provide dietary services to the long-term care industry, and that was Strategic Dining Services and Aviance. And both of them submitted proposals back in August. At that time, we did do an evaluation of both companies. And so we evaluated both companies on quality, price, availability, which means how quickly they could get a manager into the building, their overall qualifications or experience in the long-term care industry, and we did that by also contacting references, and we also took a look at their ability to provide cost control. But the main issue was taking a look at the quality of the service, because we all understand at the nursing home that food service is probably the most obvious quality indicator, because I don't think in any nursing home, no one is 100%, or we never get 100% satisfaction for all the residents. And in our case, our satisfaction ratings, without question, have been low. And it showed on our Pinnacle survey scores that the food service was clearly the worst performing department in the nursing home. And that's why we started to try to make improvements way back in the beginning of 2013. So in evaluating both companies, management saw that Strategic Dining Services, or SDS, looked to be the better of the 2 companies. And so we talked it over with the Board of Directors earlier this week at our meeting. We went over the various, not options, but the various criteria. And based on that criteria, management was provided the recommendation to start negotiating with a food service management company. So right now, we are currently trying to negotiate a contract with SDS to expedite the process to get someone in the building as quickly as possible. We are also working on a memorandum of understanding so that we can continue to work on a contract. If it happens that the contract negotiations with SDS fails to go through, then we will start discussions with Aviance. But the reasons why we're going with SDS, we contacted the references. Now, I can tell you that SDS, at the time we contacted the references back in August, had no nursing home clients in the state of Illinois. They recently signed a contract with Pathway Senior Services, which is a pretty large Chicago-based nursing home chain. We contacted 3 nursing homes located in the state of Florida. And I'll read some of the comments that were reported back to Karen. One facility said that they have been utilizing SDS for less than a year, but would highly recommend them as they helped them get a quality dining service manager that this facility had not been able to do themselves. Sounds pretty similar. They're very thorough and follow up great approach with employees during the change was wonderful, and they saw improvement within 2 to 3 weeks in quality and satisfaction of their residents. Facility number 2, also in Florida. They've been with SDS for 2+ years, and they are absolutely fantastic. Got us out of a heap of trouble with diets. They are excellent and have improved the quality of the food and client satisfaction. Reference number 3, which was in New York. They basically said superior dining services with significant impact or improvement on resident satisfaction and referrals. We had the same type of reference feedback from the other company, Aviance. So in terms of the quality of the services, both are great. Both will charge a management fee. SDS will charge $2,500 a month, Aviance $3,500 a month. Both companies say that they can actually reduce our costs. Both companies came in August, took a look at all the costs in the dietary department back in August. And again, no surprise, they both say, yes, we can also reduce your costs while increasing the quality of the care from the dining service. But SDS is willing to put that into the contract. Our average dietary costs, inclusive of salaries and non-salary expense items, is about $19.50 per resident day, sometimes $20 per day. SDS is saying that they can get it down to $18 per day while actually increasing the quality of the product. That could equate, and that also includes their management fee. Potentially, that could be a minimum of $100,000 to $120,000 in annual savings if they hit that $18 per day target. And again, they're willing to put that into the contract. So one of the other items that we want to add into the contract that we're currently negotiating is to put in some quality measures to ensure on a contractual basis that in the event that we see a decrease or we're not satisfied with the quality of the product, it will be in the contract, and we have options to either get out of the contract or some other options that we have with the company to try to improve the quality. But again, based on the references that were absolutely glowing, I can say, at least based on that, that we have a very strong possibility of getting both an improvement in the quality of service while saving a few bucks at the same time.
Scott, a couple things, excuse me, a couple of things on that. With regard to the dietary planning and documentation, would this firm do that?
Yes.
Okay, and how does that, having an outside firm do that, how does that interact with the compliance program? So are there any things that will have to be done differently?
No.
Because we have to oversee an outside firm as opposed to seeing an employee?
No.
Okay. I understand that you said the compensation was $2,500 or $3,500 a month. That can't include the director's salary, right?
No.
So we continue to pay that?
Yes.
In terms of the overall cost, that director would continue to be an employee of the nursing home, would be an employee of MPA, or would be an employee of this company?
Employee of the company.
Employee of SDS?
Yes.
Or of the successful vendor?
Yes.
But we would pay that?
Yes, as a pass-through.
And who determines that compensation?
I think it would be mutually agreed upon. We've already provided our salary
Okay.
ranges to them.
But the work would continue to be done by nursing home employees?
Yes.
So this has no implications as far as the labor contract?
No.
Okay, thank you.
And again, we've already have approval from the union on making this move.
Yeah, that'd be interesting to hear about the approval from the union. How long has it been since the director and the assistant director were there were only one working? How many months did it take before the hire?
This was ongoing since about April, where we had either just a director or an assistant director in place. So right now, obviously, both positions remain open. Karen Nofke, our administrator, has a sanitation certification. So she can, based on the regulations, be designated the interim food service director. But again, she can't wear both hats as an administrator and food service director for any prolonged period of time. So obviously, we're also getting a lot of volunteer work from both our managers and a lot of the other ancillary staff to help out in any way, shape, or form to make sure that the dining services, and it's not an optimal situation that we're in on a short-term basis, we're going to do everything we can to maintain the food service, but we want to get someone in there as quickly as possible so we can get things moving in the right direction.
And that goes to the question, because it seems like, from my understanding, this has been going on for quite some time, where there's been a problem with trying to manage the dietary service, and I agree that there is a correlation to the census. The question I have is, will the new company have that ability to change that? What will we do to change the situation that is occurring there if you're managing the situation? And then if we get involved in an agreement with this subcontractor, I guess, and then we put an RFP out, and something changes there, how does that impact those connections?
So in this case, I think we can easily define this as an emergency situation. So we are not going through a formal RFP process, but we are obviously have gone through a proposal process with the vendors. In terms of their ability to say what they're going to be doing, we're basing a lot on the reference checks, and again, they were 100% behind positive for the companies. And let me know if I'm not answering your question, because now that I'm speaking, I'm thinking I'm not answering your question.
I guess I don't understand.
if we're putting an RFP out and you're somehow is the management, if there is a different company that's running the nursing home in 6 months, do they have a contract with a company that you're making a contract with?
Okay.
And how do we negotiate with another company for employees' wages and benefits?
If that transition would happen to take place, then I think you just need to make sure that that's covered. Now, the contract is with the nursing home, not with MPA. So there shouldn't be any reason why that wouldn't continue.
Yes, I do have a series of questions. I want to start with asking you, what is your analysis of what's going on in the nursing home that it is so problematic to solve this dietary situation? It's been going on for almost a year.
The problem is finding a well-qualified dietary director and assistant director.
Well, then, if we can't find one, what is the magic of hiring any one of these firms to do the job?
Again, they have shown the ability to be able to find, and the other thing is to train and bring in competent managers. Again, I don't have any prior experience for either of these two companies. But what we have control over is checking their references. And again, their references said, and again, I gave you one example where they specifically stated that they had significant problems in finding a competent manager, but SDS was able to immediately bring in a manager that fit the bill. And within 2 to 3 weeks was able to get the department turned around and moving in the right direction.
Okay, and so what is the calculated additional cost that we're going to be seeing in relationship to the nursing home with taking this avenue?
Again, right now, our average cost in the food service department is about $19.50 per resident day. SDS is willing to contractually state that they can get our food costs down to $18 per day, which will actually result in an overall savings of at least $100,000 to $120,000 on an annual basis, and that $18 includes all expenses in the food service department, including their management fee. So we will not be paying anything more. In fact, we have the potential of saving a significant amount of money in reducing dietary costs.
And they didn't explain how they're going to go about doing this.
Secrets.
I mean, we're going to starve the, never mind. My next question has to do with what kind of contract length are they asking for?
It'll be a 2-year contract, but if they do not hit the performance targets with the $18 per day, they've put in a provision that we can get out of the contract early.
Okay, and does this contract come to the county board for final approval?
No, it goes to the nursing home board.
Okay, well, I share Mr. McGuire's concerns. We are preparing to put out an RFP for the nursing home, in January or February, and even though this is a contract with the nursing home, not a contract with MPA, I have major concerns about willingness of other outside contractors to step forward to submit to the RFP if part of what they are coming in to manage is already contracted out to another entity.
Can I respond to that?
Yes, go right ahead.
It is fairly typical in both the nursing home and the hospital industry to contract out food service because of some of the requirements of the food service director, especially around the dietary requirements. And the reason that those companies are often successful is because they provide the training that Scott mentioned, as well as some opportunities for advancement for people in food service that might not be available to them in a different setting. So they have kind of a stable of people that they're able to move around in the country. And I think most management companies who would be coming in to manage the nursing home would be encouraged rather than discouraged to have the food service managed because it's often a problem to manage on a basis, which is why these food service companies have been able to develop, because they've developed an expertise and have meet a need that is difficult to meet. So I think that would not be a deterrent for a company coming in to respond to the RFP for management services. I think it'd actually be an attraction.
I also want to point out, just very quickly, that we already outsource the therapy department. The therapy department is not our employees. And again, the reason why is because historically, standalone facilities have a very difficult time finding, attracting, and keeping qualified therapists. So it's a perfect analogy that requires the outsourcing of those services to a company that can provide it to multiple facilities across the state or across the country, and it does provide a better quality service at a lower cost than we can provide ourselves.
Josh?
Yeah, Kathy very properly kind of said what I wanted to say about the way this is becoming somewhat of an industry standard, especially if you look at hospitals and such. I also want to say, folks, we found a solution that is going to bring in the management we need, that's going to save us money, that's going to increase the quality of the food. I'm amazed that we're taking this long to go through this stuff. It's a very straightforward thing. It's done all the time. The creation of the Nursing Home Board of Directors was specifically to handle these kinds of things so that the board itself doesn't have to deal with the day-to-day management. And one final comment is that I know I'm on the RFP committee to look at this, but I am extremely happy with MPA's performance managing the nursing home. They are a deal. They do a heck of a lot more than anybody gives them credit for. They have brought this nursing home from the brink of financial ruin to what is at least a break-even point while still maintaining the mission of taking care of Medicare patients. This idea that we're worried that we'll enter a contract with a food service agency and then get rid of MPA and this new group won't want to work with that, I think that's a really irrelevant concern. And I just hope we can move forward with supporting this, because I think it's a great idea. It's solving a problem we've been dealing with. This is a company that is professionally built around finding managers in this kind of area and putting them in places to deal with these problems. I think it's a great solution.
Thank you, Josh. Let's start with James. We got a list here going after Stan. I'll put you down. James first.
All right, thank you. I just wanted to say I'm glad to see that in light of a method that was not working, that you looked for alternative solutions and evaluated options and seem to have found one that has at least high potential and seems to have a backup plan in case it doesn't work out exactly the way we think it's going to. So congratulations and thanks.
Thank you, James. Next is Jim.
You expressed, I'm talking about the salaries of the managers, you expressed what our wages are for these directors, but what are like pay rates for the people that work in these other facilities like ours? And is there still a possibility that this might increase? And we're going to be paying another $2,500 a month to do this. And I would hope that it was, you were trying to get the food costs down anyway. That would be part of your management responsibility. So where we're saving is kind of the question in how we're managing the facility.
Astrid, microphone, please.
As an old lady who spends a lot of time with other old ladies, as I said 3 years ago, I hear bad things about the food. I have heard bad things about the food for years. Now, I think the main deterrent for people who have a choice of where to go is the food. I don't hear anything else bad about it except just the food. So I think if you fix the food, maybe we could be in a better place.
I have Stan up next.
I guess I just want to say I somewhat feel Josh's frustrations over there, but on the other hand, I also go back to when the nursing home was built and all the problems that arose, and everybody sat back and said, well, we should have asked more questions, we should have looked at it finer, we should have done this. Believe you me, I'd rather be home watching TV or doing something than hearing this all the time, but there are good questions that come out of it, so I respect that. I do respect that. And I'm also thinking, I'm sitting here, schools, other entities that I've known all my life, I mean, I'm sort of surprised maybe that we didn't look a little sooner at this, that we waited this long, because every time we sit in these rooms and we talk about the nursing home, we always say, well, what else is new out there? What initiatives can we take? What can we do to help? And then a light bulb goes off 2 years later and someone's saying, geez, this might be the apple pie that we need. And I'm one, when I hear everybody make comments about how great it may be, take ownership in it, and if it doesn't work, I always like to see someone be held accountable.
Lloyd?
I'm with Mr. Stan, and you know, if you're gonna come back, and I'm serious about this, if you're gonna come back and ask somebody for $900,000, you should hesitate to show them some kind of paperwork. This is what's wrong with this problem. All of that go on down there, but when they come here, you never see manufacturers that you can look at and digest and say, well, this is okay. But they want you to vote on it. This is some of our problem. Now, the company probably good, but at least we should have the opportunity to look at their cost sheet and see how much they costing us. Or compare with these barrel of apples or this bag of apples and see which one is more feasible. That's the way I like to do, that's the way I prefer doing things.
Thank you. Gary?
Thank you, Mr. Chair.
I think after Gary, we've just, have put this discussion to rest. Please, Gary, would you continue so
The
that Scott can finish his
MPA and the
report?
nursing home board of directors have been struggling with this problem for almost a year. Quite frankly, we've run out of options. We've got to have somebody in there soon. Food service is one of the most critical parts of the nursing home and the most marketable item. In other words, if you want to market the home, you need to have a good reputation for food service, among a few other factors. And I'm willing and ready to try something different, because what we've been doing in the past hasn't been successful. Thank you.
All right, that's it on that discussion. Scott, you want to continue?
Yes,
Your report.
this last slide, and it's a summary of the annual survey. Our annual IDPH inspection occurred last week. They arrived on Tuesday. They exited on Friday. We ended up with very excellent survey results. We had a total of 6 tags or deficiencies. 5 of those were federal tags. 1 was a state tag. And I'll go through these as quickly as possible. The first was for infection control. I'm sorry, quality of care. A PICC line. A PICC, is basically a semi-permanent IV line that gets threaded up into your arm. And it's usually to give high-dose antibiotics or TPN, which is food through your IV. And what was missing was, nothing was wrong with the PICC line in this particular resident, but the nursing staff on some occasions failed to document the assessment of the arm. So we're supposed to assess and measure the circumference of the arm, so let's say it's 10 inches. And then the
Scott,
next,
let me interrupt.
Okay.
Some of these items, I think we can send out electronically to the board. We really don't have to break them down in detail. Just give us an overview of the report, and anything in specific detail, send that out electronically to the entire board. Would you please?
Okay, I'm sorry.
Okay? Because I
Okay.
got to take a break, because half the people are crossing their legs here right now, and we really need to get them a 10-minute break here. So please give us the rest of your report, okay?
So what I can tell you is in 2012 and 2011, we had 12 and 14 tags respectively in those years. We were down to 5 federal and just 1 state tag. So it's a significant improvement. The scope and severity was minor in nature. The highest scope and severity, we had an F. We didn't have a G or above, which is where we start dealing with fines and penalties. So overall, a much, much better survey this year. And again, considering where we are with the dietary department, we had a very good survey in the kitchen, despite the issues that we're dealing with. That is it.
I love your detail. We'll talk about the next report shortly. All right, let's take, it's about 10 to 9. Let's take about a 10-minute break or a 9-minute break. How's that? We've gone from 7 to 8 to 9. Take a 9-minute break because we should be able to run through the next quickly, but everybody just take a quick break and we'll be right back. Let's get back in session, please. Okay, thank you. Everybody back in their seats? Excellent. Let's move on. We're moving to the standing committees, facilities.
Nothing to report, Chair, other than to say that we're moving right along, and our new facilities director seems to be on board, and he seems to be doing a good job to date.
So far? To date. Okay. Which is what, a week and 2 weeks? 2 weeks, okay. All right. Dana, congratulations. You made it through 2 weeks. Environment and Land Use, Mr. Langenheim.
What a nuisance. I move approval of ordinance number 939, amending the zoning map to change the zoning designation from B5 Central Business Zoning District to R1 Single Family Zoning District on property at 2501 County Road 2100 East, Thomasboro, in zoning case 762 AM 13.
Second.
Discussion?
Okay. This is a zoning map amendment to allow construction of a new residence on property that formerly cited a grocery store, but has been in residential use since the 1970s. The committee recommended approval unanimously, but this was left off the consent agenda in error. The Zoning Board of Appeals voted 5-0, with one member absent, to recommend enactment of this amendment at the October 17, 2013 public hearing. The ZBA found that the proposed amendment will help achieve the land resource management plan, is consistent with the LaSalle and Sinclair factors, and will help achieve the purpose of the zoning ordinance. Since adoption of the zoning ordinance in 1973, the subject property has been split between R1 single-family residence on the north 0.96 acre of the property and B5 central business on the southern 3.04 acres. The existing home is zone B5, which prohibits a new residential use as the principal use. A prospective buyer intends to demolish the existing home and buildings on the subject property and construct a new home. The area being proposed for rezoning will be contiguous with the R1 district to the north and will be large enough to accommodate a new septic system and meet all other zoning ordinance requirements. The subject 4-acre property is triangular in shape with a drainage ditch on the west and public streets on the east and south. The property is best prime farmland with an LE of 100. Approximately 0.4 acres of the property proposed to be rezoned is in agricultural production. The remaining 2.8 acres of the 4-acre lot will remain in agricultural production. I move for a roll call vote to record the 12 affirmative votes required for approval of this map amendment.
Second. Second, thank you. Any other discussion? Ms. Esri.
Just like to say for those of you who may know Flatville, this subject property is catty corner from the Emmanuel Lutheran Church and I personally can't see any reason why not to approve this. Seeing as how it already is a house, well, why not let them tear down what's there and make something better, a better house for someone to live in?
Thank you, Mr. Esri. Any other discussion? Roll call, please.
Richards?
Yes.
Schrader? Schwartz? Alex?
Yes.
Bergson? Carter? Cowart? Esri? Harper? Harkey? James?
Yes.
Jay?
Yes.
Langenheim? Maxwell?
Yes.
McGuire? Mitchell?
Yes.
Petrie?
Yes.
Quisenberry?
Yes.
Kurtz?
Yes, motion carries.
Did that get turned off? I move approval of ordinance 940, amending the rural home occupation requirements in the zoning ordinance in case 732 AT-12, period.
Second.
Mr. Esri, discussion, Mr. Schrader.
Make a motion to defer this item to the December 19th county board meeting.
Second.
Any discussion? Chris?
Can you speak to the reason for the deferral?
Be happy to, Mr. Alex. I think this consideration deserves, hopefully we'll have a full board here, full 22 members on the board. It is a change in the ordinance, and I think we deserve to have as many members here as we possibly can. And talking with the zoning administrator, I don't think there's any problem if we delay this for a month. Nothing's really pending at this time.
Mr. Esri?
Might also say there is a protest, so we need 17 votes to override the protest. So I guess maybe give ourselves some more margin should anyone choose to vote against it.
Mr. Alex?
Works for me.
Works for him. Okay. Any other discussion? On deferral, all in favor? Aye. Opposed? Motion carries. Thank you. It's deferred to next month.
That finishes you up with the environment and land use. That's all.
That's all.
That-
Now you can turn up your microphone.
There's nothing for board action from the Highway Committee.
Okay, thank you. Let's move on to policy. Mr. Quisenberry. Go, James.
Let me get in front of my agenda here again.
Having trouble electronically, sir?
Sorry, I'm
Would
going
you like a hard copy?
use the old-fashioned method here.
Oh.
Mr. Chair.
Oh, I like that one when that
I move the
happens.
adoption of resolution number 8708, appointing Donald W. Lynn to the Nursing Home Board of Directors for a term of December 1st, 2013 through November 30th, 2015, and I so move.
Have a second. Mr. Maxwell. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Policy moves the adoption of resolution number 8709, appointing Samuel P. Banks to the Nursing Home Board of Directors for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second by Mr. Hartke. Discussion. All in favor? Aye.
Aye.
Opposed? Motion carries. One opposed.
Next
Motion
is,
carries.
I move the adoption of resolution number 8710, appointing Catherine Emanuel to the Nursing Home Board of Directors for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second, Mr. Maxwell. Discussion. All in favor?
Aye.
Opposed? Motion carries.
I move the adoption of resolution number 8711, appointing Catherine Capel to the Zoning Board of Appeals for a term running from December 1st, 2013 through November 30th, 2018, and I so move.
Second, Mr. Esri. Discussion. All in favor?
Aye.
Opposed? Motion carries.
I move the adoption of resolution number 8712, appointing Deborah Grice to the Zoning Board of Appeals for a term from December 1st, 2013 through November 30th, 2018, and I so move.
Second, Mr. Mitchell. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, I move the adoption of resolution number 8713, appointing Marilyn Lee to the Zoning Board of Appeals for a term from December 1st, 2013 through November 30th, 2018, and I so move.
Second? Second, Mr. Schroeder. Discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, I move the adoption of resolution number 8714, appointing Bernie Magzamin to the Public Aid Appeals Committee for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second?
Second.
Second, Mr. Alex. Discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, policy moves the adoption of resolution number 8715, appointing Andrew Cornstum to the Public Aid Appeals Committee for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second, Mr. James. Discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, policy moves the adoption of resolution number 8716, appointing Brian Rona to the Public Aid Appeals Committee for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second, Mr. Mitchell. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, policy moves the adoption of resolution number 8717, appointing Christine Bruns to the Rural Transit Advisory Group for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Second. Second, Mr. Esri. You've got to give him a shot. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, policy moves the adoption of resolution number 8718, appointing Elaine Fowler Palencia to the Rural Transit Advisory Group for a term from December 1st, 2013 through November 30th, 2015, and I so move.
Okay, let's not get excited about this, guys. It's just an appointment. We'll have a second by Mr. James. Any discussion? All in favor?
Aye.
Opposed? Okay.
Sorry.
Go, James, go.
Mr. Chair, policy moves adoption of resolution number 8719, appointing Cynthia Bell to the Senior Services Advisory Committee for a term from December 1st, 2013 through November 30th, 2016, and I so move.
I need a second. Aha, Mr. J, a new voice is heard. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Mr. Chair, policy moves adoption of resolution number 8720, appointing Jimmy Kaiser to the Senior Services Advisory Committee for a term from December 1st, 2013 through November 30th, 2016, and I so move.
Second by Mr. McGuire, jumped right in there. Okay, any discussion? All in favor?
Aye.
Opposed? Motion carries. Continue.
Mr. Chair, policy moves adoption of resolution number 8721, appointing Jane Nathan to the Senior Services Advisory Committee for a term from December 1st, 2013 through November 30th, 2016, and I so move.
Second. Astrid. Okay. Any discussion on this? All in favor?
Aye.
Opposed? Motion carries.
I want to make sure Mr. Langenheim voted on each one of those. I wasn't paying close attention. Vanity had nothing to do with it, Mr. Langenheim. Policy moves the adoption of ordinance number 936, amending the county health ordinance, section 12
Yeah, I don't know where it disappeared.
Section 12, for fee waivers for nonprofit organizations, and I so move.
Second?
Second.
Second, Mr. James? No? Oh, it was Mr. Alex. Sorry, the voices sound the same, but not, you don't look, never mind. Any discussion? All in favor?
Aye.
Well, I'm sorry. Mr. Carter?
I've been trying to get, you know, I'm gonna make this real quick. Some of us don't know any of these appointees, and I've been trying to bring this point to the chair's attention.
Mr. Carter,
Why can't-
we're not talking about appointments at this point. We're talking about an adoption of an
Well,
ordinance.
you asking me to vote on somebody? I'm a senior citizen. I
The
know I'm
ordinance is in the
concerned
packet, sir.
about that.
Mr. Carter, the ordinance is in the packet. We're not talking about an appointment here. We're talking about
I was
amending.
trying to let you get through the process before I say anything. That's
oh,
what
I
I'm
see.
doing. And all I'm gonna say,
Go ahead.
please,
Go
I
ahead.
hope it come to one day that we have the opportunity to know who we voting on. That's all I want.
Now, sir, the packet has a full resume of every one of these appointees. I interview all of the major committees. I've interviewed for hours the ZBA applicants and the nursing home board applicants. And under statute, that is my responsibility, and it is the responsibility of the board to look through those applications and have questions if they want, and discuss that appointment when it comes up on the floor, and then the board decides whether they want to vote yes or no. And that is the process that takes place when it comes to appointments. You can ask any question you want about any appointment. The packet is full of information about each applicant, sir. And just because you don't meet them, doesn't mean they don't qualify for these committees.
I'm not saying that. What I'm saying is, mine, you know, I feel just like you do. If you got the opportunity to know that you voted on somebody and confident, I like that same opportunity. That's all.
So you're saying, sir, that 22 of us here should interview each one of these applicants so that everybody should get the, well, just you or all of them? Well, if you want that opportunity, then every one of these members here has that right too, sir.
Listen, John, but that is so cold. No, I don't want that. But could they come up here before the whole board and say, I'm Joe Blow?
Well, we had one. It's voluntary. I can't force them to come before this board to say, I'm Joe Blow, okay? Or whoever they are. They are appointees that I have asked you to approve. And they have come or not come based on their own. I cannot force them to come before you and introduce themselves. I can ask them, but it's voluntary. Mr. Maxwell asked the former general, to come, and he came. He said a couple of words. Did that make it any better for you to vote for him because he introduced himself to you?
No, right now, I'm gonna call you responsible.
Okay, enough. Thank you. Let's move on to this ordinance. All in favor?
Aye.
Opposed? Motion carries.
All right, now we are on the last item on the policy agenda. So, policy moves the adoption of resolution number 8722, authorizing the fiscal year 2014 calendar of meetings, and I so move.
Second, please. Second. Second by Mr. James.
Mr. Chairman.
Discussion,
Mr. Chairman, I would like to offer an amendment to this calendar to set every meeting scheduled on it, excluding the highway meeting, to 7 p.m. I move to change the meeting times in this calendar for all the meetings, excluding the highway committee meeting, to 7 p.m.
I understand that people would love to talk more at caucus, but I'm against having meetings that run so late that we're brain dead when we actually vote. So I will have to vote against it.
I just find that by the time we get off of work and then we can come to the meeting and have our caucus beforehand, 6 o'clock seems to work. It's best for staff. They would like to get home, as we all know, and not that they're complaining, but if we go to 7, look how long our meetings run. So I hope everybody in this room sticks with 6.
Any other discussion? All right, all in favor of this amendment to move everything to 7 o'clock? All in favor?
Aye.
Opposed? Aye. Division. All right, let's have a hands raised. Okay, all those in favor of 7 o'clock, raise your hand. 1, 2, 3, 4, 5, 6, 7. Got 7? 7. All opposed? 2, 4, 6, 8, 10, 11? 12. All right, motion fails. Now let's move back to the main motion, which is the calendar of meetings. Discussion, Mr. Alex.
Mr. Chairman, I'm going to offer an amendment to try for 6:30 for all of the evening meetings.
All right, we now have a second on an amendment to 6:30. We have any discussion on that? Mr. Alex?
If I could speak briefly to the amendment, it seems that half the people want 6 and about half the people want 7, so it seems like a reasonable compromise that gets people home a little earlier but still allows caucuses to meet ahead of time might be 6:30. Thank you, sir.
Thank you, sir. Any other discussion? All right, here we go. All in favor of 6:30, say aye. Aye. All opposed? Aye. Division. Raise your hand for in favor of 6:30. 3, 6, 7, 8, 9. All in favor of, now back, okay, now, I'm sorry. Let's do it again. Raise your hand if you're in favor of 6:30. 2, 4, 6, 8, 10. Right? 10. All opposed, please raise your hand. 9. Motion passes at 6:30 for the meetings. So now we go back to the main motion of the calendar for 2014. Any discussion on the entire calendar? All in favor? Aye. Opposed? Aye. Motion carries. Okay. Finance.
Thank you, Mr. Chairman. The Finance Committee moves adoption of resolution number 8723, recommends adoption of resolution number 8723, payment of claims authorization, and I so move.
Second, please. Second, Ms. Coward. Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Thank you. Finance Committee recommends the adoption of resolution number 8724, purchases not following the purchasing policy, and I so move.
Second, Mr. Esri. Discussion? All in favor?
Aye.
Opposed? Motion carries.
Finance moves adoption of ordinance number 937, authorizing fiscal year 2014 annual tax levy, and I so move.
I need a second. Ms. Coward, I also need a roll call vote for 12 votes to pass this adoption of this ordinance. I'd like a roll call, please.
Richards? Schrader?
Yes.
Schwartz? Alex?
Yes.
Bergson? Carter? Cowart? Esri?
Yes.
Harper?
Yes.
Harkey?
Yes.
James?
Yes.
Jay? Langenheim? Maxwell? McGuire? Mitchell? Petrie? Quisenberry?
Yes.
Kurtz?
Yes. Motion carries.
Thank you, Mr. Chair. Finance recommends adoption let me try that again. Finance recommends adoption of ordinance number 938, authorizing the fiscal year 2014 annual budget and appropriation, and I so move.
Second by Mr. Langenheim. Yes, sir. I need a roll call on this as well, please.
Richards? Schrader?
Yes.
Schwartz? Alex? Bergson? Carter? Cowart? Esri?
No.
Harper?
No.
Harkey? James?
No.
Jay? Langenheim? Maxwell? McGuire?
No.
Mitchell? Petrie? Quisenberry?
Yes.
Kurtz?
Yes. 12 to 6. Motion carries. 13? Did I get 13? I missed one? 13, sorry. 13. Motion carries.
Thank you, Mr. Chair. Finance recommends adoption of resolution number 8725, authorizing the issuance of tax anticipation notes for Champaign County, and I so move.
I need a second on that, Mr. Hartke. I need also a roll call vote on this motion, please. Oh, discussion. I'm sorry. Is there any discussion? Ms. Petrie.
Yes, just for the record, I will not be supporting this, not because I don't think eventually the nursing home will need these bonds. I just think it's too early for us to be getting them.
Okay, any other discussion? I need a roll call, please.
Richards. Schrader.
Yes.
Schwartz. Alex. Bergson. Carter. Cowart. Esri.
Yes.
Harper.
No.
Harkey.
Yes.
James.
No.
Jay.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGuire.
Yes.
Mitchell.
No.
Petrie.
No.
Quisenberry.
Yes.
Kurtz.
Yes, motion carries. We have an addendum.
Yeah, thank you,
Chris.
Mr. Kurtz. I've got one more item, if you'll give me time to find it. This is from the Finance Addendum. I move adoption of Resolution Number 8735, authorizing budget transfer 13-00011. This is from the books, periodicals, and manuals line of the Law Library Fund into regular part-time employees, Social Security employer, IMRF employer cost, and workman's compensation insurance, also within the Law Library Fund for a grand total of $710.
I have, you so move. I have a second by Mr. Quisenberry. This is a roll call, and we need 15 votes to move this massive sum of money from one line to another. Roll call, please. Discussion. James.
I assume this is just a simple shortfall that we're
Yes,
trying to make up.
That's all it is. Roll call.
Richards. Schrader.
Yes.
Schwartz. Alex. Bergson. Carter. Carter. Cowart. Esri.
Yes.
Harper.
Yes.
Harkey.
Yes.
James.
Yes.
Jay.
Yes.
Langenheim.
Yes.
Maxwell.
Yes.
McGuire.
Yes.
Mitchell.
Yes.
Petrie.
Yes.
Quisenberry.
Yes.
Kurtz.
Yes. Motion carries. Thank you. All right. We're not quite done yet tonight, folks. Yes, Mr. Quisenberry, go.
I'd like to move that we go into closed session for two reasons. First, pursuant to 5 LCS 120/2C5, to consider the purchase of real property for use by the Champaign County with the county engineer, county administrator, deputy county administrator of finance, and recording secretary to remain present. And two, pursuant to 5 ILCS 120/2C1, to consider the employment, compensation, discipline, performance, or dismissal of specific employees of Champaign County with the county administrator and recording secretary to remain present, and I so move.
I need a roll. Second by, Mr. Harper he hasn't gotten any action tonight at all. We'll give him a shot. I need a roll call on this, please. What is
Richards.
this? Well, we're moving into the closed session.
Schrader.
Yes.
Schwartz. Alex. Bergson.
Bergson. Yes.
Carter. Cowart.
Are we going to discuss this first? No, it goes in with us.
Ms. Cowart. Esri.
Yes.
Harper.
Yes.
Harkey. James.
Yes.
Jay. Langenheim. Maxwell. McGuire.
Yes.
Mitchell. Petrie. Quisenberry. Kurtz.
Yes. All right, motion carries. We're going to be moving into the Putman room. Go ahead.
Please bring your confidential envelopes with
Please
you.
bring the manila envelope you have on your desk with you. Please don't leave them out here. And there'll be, just to let you all know, if anybody's here, there'll be no business after these two closed sessions, so there's no reason for anybody in the public to hang around.